Patients that are looking for the right treatment for their anxiety or depression often have to cycle through many different treatment options. And whether or not that's antidepressants or more novel technologies like deep brain stimulation, patients will go through a long period of time of the span of months just to treat their psychological disorders. But along the way, a lot of these treatment options also induce side effects, very nasty side effects that will even cause the patient to stop treatment altogether. And in order to mitigate this, we wanted to find a way for patients experiencing psychological disorders to find the treatment that works best for them in a short period of time without experiencing horrible side effects along the way. So at a high level, we wanted to be able to work with the patient without working on the patient. And in order to do that, we worked on a drug screening platform for patient samples looking at serotonin biomarkers, which led us to extract organoid samples from the patient. And these organoids are three-dimensional stem cell structures that maintain fidelity to, say, a portion of the human body, such as the gastrointestinal tract, which is what we focused on. We merged two very complex ideas, that being organoids and microfluidic chips. And we really just wanted to ask ourselves, can we make this work? Can we reconcile these two halves? And can we have something at the end of the year? Right, so along the two halves of our project, first with the organoids, we wanted to know if that when the organoids were bathed with an antidepressant treatment, if they would have a serotonin response that was measurable. And on the other half of the microfluidics, we just wanted to be able to ask whether or not we were able to build a microfluidic chip that could house the organoids without letting them die. In order to make these two halves work, luckily having a large team allowed us to specialize our team members. So we had two members of our team focus on organoid growth and culturing over the 18-week time period. And the other two team members worked with the microfluidic foundry to build and iterate upon multiple versions of our microfluidic chip. And I myself oversaw a lot of the planning for both ends. So regarding the planning about putting these two halves together, the microfluidic chip had to be ready around the same time that the organoids were at a mature state. So on the organoid side, over the course of many weeks, we just wanted to be able to start with first whether or not we were able to grow the organoids, mature them, expose them to antidepressants, and then eventually be able to expand to different patients and see whether or not we can maintain the same consistency. And this was all done outside of the chip. On the other half of the microfluidic chip, we weren't in such a time rush. We weren't so pressed for time, given the organoids requiring weeks to grow. But the microfluidic chip, we did a lot more extensive research on the necessary components. We iterated upon many designs, and eventually we were able to build a microfluidic chip that could begin to house organoids without testing. And eventually we were able to arrive at a microfluidic chip that successfully was able to house organoids. We were able to put the organoids into the microfluidic chip and allow them to grow and actually thrive in the chips over several weeks. But from there, we were also able to expose these organoids to antidepressants and get patient-specific serotonin readouts. And what these serotonin readouts showed us was that across different patients, patients will express unique responses to antidepressants in terms of their serotonin levels. And we hope that this serotonin difference would eventually correlate to a patient-specific response, whether or not they would respond positively, negatively, or have terrible side effects to these treatment options. And also being able to look at multiple treatment options allowed us to be able to compare these patient responses. And hopefully, if we were to apply this to a real-world scenario, we'd be able to find a treatment option that works best for the patient based on a appreciable serotonin readout data.